One of the things that happens when you look at blood pressure in men and women, you see two very different patterns. Young women have lower blood pressure on average than young men, but at the menopausal transition, blood pressure begins to rise in women, and by age 70, more women have high blood pressure than men. So you see this sort of bimodal distribution, and in men, blood pressure drifts up with age, and in women, it's a hockey stick. And what we've discovered in my lab is that estrogen plays a key role in explaining why blood pressure is lower in young women and higher in older women. The first thing estrogen does is it affects the endothelial function of your blood vessels. The endothelium is the lining of the blood vessels, and estrogen keeps that lining slippery and helps relax the blood vessels so they're not tightened up and that they're not very responsive to clamping down. This explains why young women have lower blood pressure because they have high estrogen levels, and it also explains why young women are more likely to faint than young men. As women get older and they lose estrogen at menopause, two things happen. One is they lose that protective effect on the endothelium, so the blood vessels get less slippery and they get more likely to clamp down. And the other thing that happens is estrogen suppresses the level of the fight or flight nerves, which constrict the blood vessels. When that's lost, this nerve traffic goes up, and things like norepinephrine, which is a chemical relative of adrenaline, are increased in the bloodstream, and that causes the blood vessels to clamp down. I think right now, the hormone replacement therapy thinking is probably short-term, maybe to help people get through some of the menopausal symptoms, but I think it's possible with new formulations and perhaps with some newer clinical trials that we'll begin to see information which challenges some of the dogma in terms of safety and efficacy for menopausal hormone therapy. And you might also see new formulations, and also we might be able to better predict who should and shouldn't be on menopausal hormone therapy. But I think that's a long way off. And what we've really contributed here is an understanding of the differences in blood pressure between men and women, young women with lower blood pressure, older women with higher blood pressure and greater susceptibility to hypertension. I think the most interesting thing about this is just how different blood pressure is in men and women, and how young women are more susceptible to problems with low blood pressure, and older women are more susceptible to problems with high blood pressure.